Welcome to the deep dive. Today we're tackling something really critical, potentially life-saving: how to handle severe bleeding.
Yeah, it's one of those things where every single second counts, and knowing what to do, what tools to use, it's vital.
Absolutely. And we're specifically looking at, well, the differences between tourniquets and something called the Slishman pressure wrap. How do they stack up for controlling major hemorrhage?
Exactly. Because when you're faced with that kind of emergency, you need clear, reliable information. And fast.
So our mission today is to give you that clarity. We want you to understand the pros, the cons of tourniquets versus these wraps, and crucially, how to use them the right way.
And we're drawing on some solid sources here. Videos from folks like Sam Slishman, St. John Ambulance, the American Red Cross, LA City View 35.
Right, and articles too from ResponderWare and the First Aid Quality Partnership. So a good mix of perspectives.
Definitely.
Okay, let's get straight into it. Someone's faced with, really bad bleeding. What are the absolute first things they need to do?
Well, first you got to recognize it's severe, right? We're talking spurting blood, clothes soaked through in seconds, bleeding that just won't stop with pressure.
Or, God forbid, like an amputation.
Precisely. If you see any of that, you need to move fast. The number one priority, before anything else really, is call for emergency help. 999 or 112.
Right away. And if you're on your own?
Good point. Put your phone on speaker. That frees up your hands to actually help the person while you're talking to the dispatcher.
Makes sense. Okay, call MAID. What's next for dealing with the actual wound?
Protect yourself first, gloves if you have them. Then you need to see what you're dealing with. Cut or remove clothing covering the wound.
Get a clear view.
Yeah, and look carefully. Is there anything stuck in the wound? Like glass or debris?
Ah, okay. And if there is...
This is crucial. Do not pull it out. Whatever it is, it might actually be plugging the hole, slowing the bleeding down.
So leave it in place. What do you do then?
Apply pressure, but on either side of the object. Try to push the edges of the wound together around it.
Okay, apply pressure around it. Got it. And if the wound is clear, no objects.
Then it's direct pressure, right onto the bleeding spot. Use your fingers initially if you have to. Then grab a sterile dressing if one's available, or just a clean cloth, something non-fluffy is best. A t-shirt maybe?
And use that to press down hard.
Ah, exactly. And don't forget, if the injured person is conscious and able, you can actually ask them to apply the pressure.
Oh, that's a smart idea, empowering them to help themselves.
Yeah, keeps them involved and frees you up slightly perhaps. Now, while you're holding pressure, you need to think about shock.
Right. Severe blood loss often leads to shock, doesn't it?
It does. So you want to minimize that. Lay the person flat on their back, put a blanket under them if possible, keep them warm.
And elevate their legs.
Yes, raise and support their legs above the level of their heart, but only if their legs aren't injured, obviously. That helps blood flow back to the vital organs.
Okay, lie down, legs up, keep warm, and the dressing we applied.
You need to secure it. Use a bandage to wrap over the dressing and hold it firmly in place. Firm pressure is key.
But not too tight, I assume. You don't want to cut off circulation entirely lower down.
Exactly right. It needs to be firm enough to control the bleeding, but not so tight it stops blood flow completely beyond the bandage.
How can you tell? Is there a way to check?
There is. It's a simple check, actually. Press on one of their fingernails or a bit of skin just past the bandage for about 5 seconds. It'll go pale.
Okay.
When you let go, the pink color should rush back within 2 seconds. If it takes longer, that bandage is too tight. Loosen it just a bit.
The 2-second nail dead test, got it. What if? What if the blood just soaks straight through that first dressing and bandage?
Good question. Don't take the first one off. Just apply a second dressing right on top of the first one and bandage over that too.
Add another layer.
Yeah. But if the blood soaks through the second dressing as well, then you need to reassess.
What do you mean?
At that point, take both dressings off, get a fresh one, and really focus that pressure directly on the exact point where the bleeding is coming from. Make sure you're hitting the source.
Right. Pinpoint the pressure. And keep checking circulation.
Yep, check that circulation using the nail bed test every 10 minutes. And support the injured limb. Maybe use a sling for an arm. And critically, keep talking to them. Keep monitoring their responsiveness until help arrives.
Okay, so direct pressure is absolutely the foundation, but sometimes, especially with really bad limb injuries, it's just not enough, right? That's where tourniquets enter the picture.
That's exactly when you consider them. Sources like the American Red Cross and the LA Fire Department are clear. Tourniquets are for life-threatening bleeding on an arm or a leg when direct pressure isn't working, or Maybe you can't maintain direct pressure effectively because of the situation.
Like needing to move the person.
Right. Or if you're the only rescuer dealing with multiple injuries. The basic idea of a tourniquet is simple. Apply enough pressure above the wound to squeeze the main artery shut and stop blood flow down to the bleed.
So it's about stopping the supply, essentially. Can you describe a typical one, like the windlass type?
Sure. A common one has a strong strap, a buckle to feed it through, a rod that's the windlass that you twist.
To tighten it.
Exactly. And then some kind of clip or fastener, often like a little triangle, to lock that rod in place once it's tight. There are other types, but the principle is always position it, tighten it till the bleeding stops, and then secure it.
Okay, how do you apply it correctly? Where does it go?
Placement is key. You put it about 2 to 3 inches above the wound. So between the wound and the person's torso or heart.
Not right on the wound.
Definitely not. And also avoid putting it directly over a joint like an elbow or a knee. It just won't compress the artery properly there.
Okay, 2 to 3 inches above, avoid joints. What else?
Warn the person. Applying a tourniquet correctly is going to hurt. A lot. Let them know beforehand.
All right. Painful, but potentially saving their life. So what's the actual tightening technique? You mentioned pull, twist, clip.
Yeah, that's a good way to remember it for the windlass type. First, pull that strap really tight around the limb. Get it as snug as you can manually.
Okay, pull tight.
Then, twist the windlass rod. Keep twisting. The aim is to make the bleeding stop completely. Don't be tentative here. Twist until the bright red bleeding stops.
Even if it's really painful for them.
Even then. That pain means it's likely working, compressing that artery. Once the bleeding stops, or if you physically can't twist it any tighter, then secure the rod in its clip or holder. Make sure it can't unwind.
Okay, pull, twist, secure. What if one tourniquet, tightened all the way, still doesn't stop the bleeding?
Good question. You apply a second tourniquet, place it just above the first one, so even closer to the body's core.
Right next to the first one, going upward.
Exactly, and then tighten that one just like the first.
And once it's on, and the bleeding is...
Yeah, and it's designed to be, simpler, more intuitive maybe, and quite versatile. It's basically a wide, strong elastic strap, about 50 millimeters wide, doubled back to make a loop, and has these hook and loop tabs, like Velcro, along it.
And it's lighter than a tourniquet.
Noticeably lighter, yeah. Around 34 grams, compared to, say, 130 grams or more for some common tourniquets. So the approach here is more about controlled elastic pressure on the bleed, rather than total occlusion above it, though it might achieve that too, if needed.
So how does wrapping an elastic bandage over the wound stop major bleeding? Is it just the pressure?
It's the combination of direct pressure and that circumferential elastic force. Yeah. You put the limb through the loop, place the start of the wrap right over the bleeding point, and then you wrap the elastic tightly around and around, keeping tension on it.
Like wrapping a sprain, but much tighter.
Kind of, but with a very specific goal and much more force. The elasticity provides continuous inward pressure, and those Velcro tabs let you lock each layer down so it doesn't slip or unwind.
And they claim it can stop arterial bleeding, too.
They do claim it can achieve full arterial occlusion if you wrap it tightly enough. But its primary design seems geared towards that direct pressure model first.
Interesting. And there's a suggestion it might be, less traumatic for the patient than a tourniquet.
That's part of the argument. The idea is that because the wrap is wider, it spreads the pressure out more than, say, a narrow tourniquet strap. This could mean less focused tissue damage, maybe less bruising.
Less painful, perhaps?
Potentially less painful, or at least the pain might be distributed differently. But let's be clear, anything tight enough to stop major bleeding is likely going to be uncomfortable, at minimum.
Of course. So it's presented as another option, not necessarily throwing tourniquets out the window.
Exactly. It's another tool. And it's versatile. They mentioned using it for ankle support, securing splints, things like that. Plus, it's small, light, fits in a pocket easily, and works on different limb sizes.
So the application method, walk us through that again. It goes over the wound.
Yes, directly over the bleeding site. Many have sort of red sleeve or loop end. You use that to get the first cinch down, right on the spot.
Like a lasso almost.
A bit like that, yeah. Get it snug down over the bleed point. Then you just keep wrapping the elastic band around the limb, pulling it tight with each turn, overlapping as you go.
And sticking it down with the Velcro tabs.
Right. Those tabs prevent it from unspooling.
Mm-hmm.
And like tourniquets, there's usually a place on the wrap itself to write down the application time.
Okay. And I heard there's a reason it's deliberately called a wrap and not a tourniquet. What's the thinking there?
Sam Slishman explains this. Calling it a wrap is intentional. Firstly, it guides users to apply it directly over the wound, not proximally like a tourniquet. The goal is just enough pressure to stop the bleeding hemostasis, right there.
So it discourages that high and tight tourniquet approach.
Exactly. Applying it way up the limb might lead to too much pressure over too large an area, maybe unnecessary damage, especially on smaller arms or legs.
Okay. What else?
Because it works by direct pressure, there's a thought that maybe, just maybe, as clotting happens in vessel spasm, you might be able to slightly adjust the tension for pain carefully, unlike a tourniquet, which you absolutely don't touch.
That's a big difference.
It is. Also, they're stackable. If one wrap isn't enough, you can apply another right over it. And the argument is made that it's potentially more intuitive for someone without extensive medical training.
Easier to figure out under pressure.
Perhaps. Less specific steps than the pull, twist, clip method. And finally, it's seen as a multi-use item wrap, splint, securement, etc., whereas a tourniquet is really single purpose, stopping catastrophic arterial flow.
Right, okay. So 2 quite different tools, different approaches. Let's really compare them head to head. Advantages, disadvantages. Where do they differ most?
Okay, well, Slishman's comparison is helpful here. Tourniquets are laser-focused on arterial occlusion, stopping that high-pressure flow fast.
That's their job.
That's their job. Wraps can potentially achieve that, but they're really designed around direct pressure first and have those other uses. Then there's weight and size tourniquets, generally heavier, bulkier due to the windlass and stuff.
Wraps are lighter, more compact.
Usually, yeah. Materials differ too. Tourniquets often use tough, inelastic webbing. Wraps typically rely on strong elastic, though there might be exceptions.
What did you be?
Tourniquets have rigid parts, the windlass, maybe a ratchet mechanism. Wraps are generally soft, flexible.
And adjustability, you mentioned that.
Big difference. Tourniquets often tighten in steps or clicks. Wraps, because they're elastic, offer basically continuous, fine adjustment. You pull it as tight as needed.
Then there's the tactical coolness factor.
Yeah, he mentions that. Tourniquets have that image, perhaps from military use.
Yeah.
Cost often differs too. Tourniquets tend to be pricier.
And the big one, application site.
Fundamental difference. Tourniquet, proximal, above the wound. Wrap, directly over the wound.
Okay, now this pressure curve idea and the risk of harm, this sounds really important. Can you break that down?
It really is. With a wrap, you're applying pressure directly onto the bleeding vessels. The idea is you increase pressure gradually, just enough to stop the flow. The hope is, as the body's own clotting kicks in,
The pressure needed might actually decrease.
potentially, yes. The ideal curve might go up, then maybe plateau or even come down slightly as natural hemostasis occurs. Tourniquets are different. They need to hit that arterial occlusion pressure quickly and decisively.
And what happens if they don't?
That's the major risk. If you don't tighten it enough to stop the artery pumping blood in, but you do tighten it enough to squash the veins stopping blood from getting out. Yeah, you get venous occlusion. Blood keeps pumping into the limb but can't leave. This can actually make bleeding worse within the tissues, cause swelling, intense pain, and more damage. Sometimes called a venous tourniquet.
So not tight enough is actually dangerous with a tourniquet.
Potentially very dangerous. And because of the way they tighten, it's also harder to judge if you could safely reduce pressure later that needs expert assessment.
Okay, so getting the pressure right is critical, and the failure modes are different. What about just the baseline pain and tissue damage?
Well, with wraps, the wider pressure distribution and adjustability might allow finding that sweet spot bleeding stopped. Pain may be more manageable. You might even be able to ease off slightly if things stabilize.
Whereas tourniquets?
Tourniquets are inherently painful. That focused constriction hurts from the get-go, and it gets worse as you cut off flow. Plus, those discrete tightening steps mean you might easily over-tighten, applying way more pressure than needed, increasing pain and tissue risk. Again, there's that risk of creating a harmful venous tourniquet if you under-tighten.
This leads into those really striking statistics Sam Slishman talks about from the Life Over Limb article based on combat data. Can you share those? They sound quite counterintuitive.
They really are sobering. Looking at soldiers who survived after having a tourniquet applied, an incredible 74% were later found to have no significant vascular injury requiring repair.
3/4 of them didn't actually have a major artery bleed.
That's what the data suggests. The tourniquet might have been unnecessary in those cases. But here's the kicker. Within that group, the ones without a major vessel injury, 83% still had pulses below the tourniquet.
Meaning it wasn't tight enough to stop arterial flow?
Exactly. It was likely acting as a venous tourniquet, stopping blood getting out, potentially causing harm, but not achieving the intended arterial stop.
Oh,
Only 17% of that no major injury group actually had full arterial occlusion from the tourniquet.
wow. So in the majority of cases where it perhaps wasn't needed, it was also potentially causing harm.
That's the worrying implication. And if that's happening with trained military use, the concern Slishman raises is, what are the numbers like in civilian use, where training might be less frequent or less intense?
It makes you wonder.
It does. How many of those cases, maybe even some of the fatalities where tourniquets were used, might have been managed just fine with good direct pressure, maybe hemostatic agents, elevation?
But it'd be a lot.
Slishman suggests it could be a substantial number. His conclusion leans towards the idea that careful direct pressure, only escalating to arterial occlusion if absolutely necessary, might actually carry a lower overall risk of harm and be, well, kinder to many patients.
That's really significant food for thought. And it connects to training, too. The First Aid Quality Partnership in the UK is looking at improvised tourniquets now.
Yes, they are. Acknowledging that proper tourniquets aren't always available and maybe mindful of these potential issues, they're recommending that training on how to improvise a tourniquet from everyday materials gets added to standard first aid at work courses.
When is that happening?
They're aiming for inclusion by October 2025, becoming mandatory in 2026. But they stress very strongly that whether it's a commercial device or improvised, you need proper training to apply it effectively and safely. Competence is key.
Absolutely. Knowing how to use the tool, whatever it is, correctly is paramount. Benefit versus harm.
That's the balance, always.
Okay, let's try and pull this all together. Key takeaways when comparing tourniquets and these Slishman pressure wraps for severe bleeds.
Right. Tourniquets. Powerful. Effective for stopping catastrophic limb bleeds if applied correctly to full arterial occlusion. But they carry risks if misused, especially that venous occlusion problem, and they are definitely painful.
And the wraps.
Slishman wraps offer a different approach. Direct pressure over the wound. Potentially more comfortable, more adjustable pressure. Possibly less risk of accidental venous occlusion if used as designed over the wound.
But the first step, no matter what, is still direct pressure with your hands or a pad, right?
100%. Immediate, firm, direct pressure is always the first line of defense. Always start there.
So it really does sound like the best tool isn't a simple answer. It depends on the specific injury, who's providing the aid, their level of training.
Less available? Yeah, it's context dependent. A paramedic might reach for a tourniquet for speed and certainty in some situations. A member of the public might find a wrap easier and safer to manage.
It really makes you reconsider things, thinking about the potential harm if a tourniquet isn't perfect versus the versatility and maybe gentler approach of a wrap. It definitely poses a question about what you'd want in your own first aid kit and how you'd approach things if faced with that awful situation.
It absolutely does. Definitely encourages more research and, ideally, proper hands-on training.
Couldn't agree more. Thanks. That was incredibly insightful. Lots to think about there.